make sure I'm practicing good Zoom etiquette.
Hi, everyone. I'm excited to be invited to talk to you all today about something that's really important and pressing. And I know a lot of people are feeling really anxious and stressed out about both what this means for education and our communities, and also more generally what this means for our country and our well-being. So I'm not even sure if Merritt knows this, but I actually am on the response task force for UNC Chapel Hill, and I've spent a lot of time in the last few weeks mentoring mostly professors and some high school teachers about how to transition online in like a triage emergency situation. So I have a couple of slides to give a background on what's going on, recognizing that there's probably a range in terms of where people are starting out with this information. And then I'm excited to just talk about whatever questions you all have. I'm pretty good at just jumping in on any sort of topic. So here's a little bit about me. I'm a political scientist. I'm in a public policy department, which I really like because it means that we're focused more on the real world implications of what we're talking about. So I mostly study inequality in the States, especially with respect to health, gender, and race. And I'm pretty easy to find online if anyone is searching for me. So, okay, the first thing I want to say is this is really scary and unnerving, and I think it's important and okay to admit that. Students really want to hear you say that you are a little freaked out too, and to acknowledge the importance of opening up a space for people to talk about it. I also feel strongly that it's important to talk about with kids of all ages. I was just talking to my niece who's a second grader, and she was kind of like confused about how important it was. School was out and she wasn't sure why she couldn't like go out and do things. And I told her that this is the scariest thing that's ever happened in my entire life. And we kind of talked about what the implications were. And I don't think we need to get students and kids freaked out. But on the other hand, kids are really perceptive, and they pick up on things, and they pick up on the energy that we give. And so it's important to have conversations with them, because if you don't have those conversations, they're still feeling that anxiety, even if you think that it's going unnoticed by them. I also want to say that the most important things that we can do, not just as educators, but just as human beings right now, is to look out for the community and the public good. So I'm going to talk briefly about how we as individuals can help the public good. But also we should be really patient and empathetic and understanding of both the anxiety and stress that some people are facing, but also the real difficulty. So a lot of people right now are trying to do their jobs, but they also have kids at home, and they're trying to learn how to homeschool their kids. A lot of people are losing their jobs right now, and there's a lot of uncertainty. So we should try to give as much grace as we can to other people. One thing that I think is really important is to think about how we can stay in touch with other people. So the clinical term is social distancing, but I saw someone on Twitter say, and I really like the phrase, physical distancing instead of social distancing. And so we should be striving for keeping physical distance from each other, but actually I think we should be checking in with each other, maybe even more often than we have been doing in the past. Okay, so here's my quick background on what's going on, why this virus is so serious, and why people should be concerned about it. I'm going to go kind of quickly because that's not the main point here, but I wanted to put enough here that if people had questions that they would have a framework to start with. So the first thing to know is this virus is really different and scarier than other viruses. The mortality rate is lower than like diseases like SARS and Ebola, which have been viruses that have been pandemics in recent years, but this one is super duper contagious. And so that's why it's so dangerous, is that it's very contagious. The mortality rate is pretty high, especially for older people. But the dangerous thing is that young people can carry it, and they often don't realize that they're carrying it. One person said that they knew that they should be staying home right now, but they didn't really understand what flatten the curve meant. So what that means is it's important to start with knowing that our healthcare system is really fragile and underfunded, and it's not going to do well in this situation. In fact, there are other countries in Europe in particular that we can compare ourselves to, and their healthcare programs are much stronger than our own. And they are facing a real crisis because they don't have enough supplies. So if you see these dashed lines going across horizontally, that's what our hospital capacity is for how much they can handle, like the number of people, the number of ICU beds. And that initial like tall curve or the standing up cat is what would happen if we don't have dramatic interventions that decrease the spread. So people are using the phrase flatten the curve. What that means is we should be socially distant so that it can't, physically distant, I'll say, so we can't spread it as easily between us. And it might still mean that our hospitals are overwhelmed and can't really handle, but if we don't flatten the curve, a lot of people are going to die, and they're going to die because we don't have enough resources, like kind of basic resources to help. Okay, so that's really scary, but actually that's the situation. So who's most at risk? Older people in particular. Younger people can die from it, but the mortality rate, especially as you get to older generations, is estimated to be between 10 and 25%. So if you have any grandparents in your life, please do not go visit them anytime soon. It's also more dangerous for people with pre-existing conditions, for people of lower socioeconomic status, because they tend to live in communities that spread viruses faster because of the infrastructure, because of hygiene, because of the density and things like that. And also frontline workers. And I put quotations around it there because I don't just mean doctors and nurses, I also mean cashiers and bus drivers and taxi drivers and things like that. So the people that are still working right now actually are at a pretty high risk. And some of those people are very vulnerable because they don't necessarily have, like if you think about your Uber driver, they're not really getting health insurance from their Uber and things like that. So they're in a precarious state, even though they're really high risk. So here's the big picture. This is what flattening the curve looks like in practice. So this is the trajectory of number of days since the 100th case. And then on the other side is a logged scale of how many infections there are in the country. And you should know that the US the numbers are really inaccurate because we have not been testing. But you can see that the kind of tealish colored lines, these are Asian countries that responded to SARS, because the SARS epidemic about a decade ago was mostly in Asia. And these countries really learned the role that public policy can play in mitigating the spread of a virus. And so they took really quick interventions to slow the spread. And you can see that their curve is much, much flatter than what we see for us. Okay, so here's what it looks like in the US right now. It's true that Seattle and Washington was the epicenter, but now it's actually New York. Though actually New York now has more fatalities as well. So this is the number of infections, but it's important to know that we're just really not testing. So we really don't know how bad it is because there's just been a huge significant shortage of tests. In many places, they're not testing people unless it would change the course of treatment or unless they're already hospitalized. So even though we're seeing all these celebrities and athletes magically get tests somehow, really the rest of the country is not able to get tested. So these numbers aren't very accurate. Here are some terms that you should know. Social distancing or physical distancing is what we're doing right now. So these are for those of us who have not been exposed to the virus. And what we're trying to do is flatten the curve. The next level up is a quarantine, and that's if you have been exposed to it and you don't have symptoms, then you should take a strict 14-day quarantine where you don't see anybody. That even means like don't see your family, don't interact with anybody, have things delivered to you outside your door. And then self-isolation is people who think that they have the virus. So I'll make these slides available, so I won't actually read out the whole thing, but those are the differences between those different words. Okay, so some grim updates. So first of all, I mentioned this before, but the US is way behind on testing. So the figure that's on the bottom is showing the number of tests that have been done per million people. And the US where is the US? We're in that tiny purple color that's like in the bottom half. And so you can see that that's really low to the number of people in our country. Compared to other countries that have made testing more available. On the other side is just a comparison to a couple of other countries. So South Korea, who has been very aggressive with testing, and Italy, who is slow to test. And right now, Italy and Spain are facing a real crisis right now. And it's possible that we will be in the same place in about 10 or 11 days. So why is the testing so far behind? A failure of policy. The WHO actually has a test that we could be using, but for some reason our country is not using it. So they've started producing a test, but they just are not making very much, and they started about 2 months too late. Okay, so more grim updates. There's actual real shortages right now of personal protective equipment, and hospitals across the country are asking people to sew masks for them. So there's a lot of tutorials online. So if you're a crafty person and have a sewing machine, hospitals are literally asking people to sew face masks for them right now. It's more critical in some parts of the country than others, but if you're in a place where there's a lot of cases right now, it's possible that the hospitals in your area are asking for your help in making protective equipment. Rationing is another word that's important to know. That means that doctors are starting to make decisions about if there's 2 people who are sick and only one person can get a ventilator, who do we give it to? And usually the first thing they'll do is not give it to older people or not give it to other people who have pre-existing conditions. And that's really heartbreaking that there's just not an alternative. We don't have enough supplies to handle this. There's things that policy could do to change that, but so far hasn't happened. Okay, so is there anything, this is a question that I got earlier. So is there anything that we as individuals can do to fix the shortage of supplies and beds? Well, we can't really fix the shortage of beds, but we can try to not go to the hospital unless we really need to. And places in different parts of the country are asking for resources and support. So I would encourage you to look out for, ask the doctors and nurses that you know in your family or in your area if you know anybody, because they would know what the local need is. And then you shouldn't drop it off at the hospital because they don't want people to go to the hospital. So usually you drop it off with a friend who's a doctor or nurse. So aside from the economic news, actually, this is another really scary figure. This is showing the unemployment claims. And you can see that it has been going down over time for the last few years, and then it has spiked super high. A lot of people have lost their jobs just in the last week. When you lose your job in the US, it often means that you lose your insurance as well. So while these people can apply for unemployment insurance right now, the reality is I'm not sure how well funded that will continue to be. And sometimes people are not unemployed, but they're underemployed or they're furloughed or in some of these kind of ambiguous positions. So some of the crisis that we'll be facing is not just the health crisis, but also the economic crisis that people will be facing. A lot of people will be food insecure and housing insecure because of this. Okay, so where to learn more? If you're not opposed to some cursing and some naughty language, John Oliver has done 2 episodes in the last few weeks that are very, very informative, and they're free on YouTube. There's also a lot of good sources. I would look for sources from places like the Departments of Health and the CDC, and not rely on, and be careful about the news sources that you rely upon. So certainly news sources like the Washington Post and the New York Times, I think are providing accurate information, but other ones like Fox News, not so much. And actually some US governors have started to encourage Americans to look towards Europe for information about the virus because of a concern that we're not getting the real information here. Okay, so that was kind of grim, but I think it's important to get that background in. So one person asked, what power does Congress have to make things better, and are they using these powers? Congress is trying, actually. I'll talk in just a minute about what Congress is trying to do. In just about 2 hours ago, there were some changes to it. But Congress is divided by party, so the House of Representatives is controlled by the Democrats, and the Senate is controlled by the Republicans. And they, as you might imagine, are not agreeing on what should happen. There is a lot more that the president can do, so I might sound like I'm being particularly hard on the president, but the president has a lot of powers to do things that he is not currently doing. There's more that governors can do too, so I'm going to mention some of these things that governors and presidents can do, but one thing that a lot of people don't realize is that state governments can't run a deficit. So state governments can't, for example, say, we're going to order a whole bunch of ventilators because there's a huge shortage of ventilators, because they can't run a deficit in their budget, but the US federal government can. So some of the things that we need done, like ordering more supplies, can really only be done by the president. Okay, so here's some ways that public policy can help. First of all, there's all these shelter in place and stay-at-home orders that we've been seeing. These governors can do on their own, and a number of them have done it. So this is comparing Kentucky and Tennessee. In one state, there was, in Kentucky, the governor very quickly and aggressively started dealing with this issue. And you can see that they have tested more people in Kentucky and have fewer cases than they do in neighboring Tennessee. So This is evidence that flattening the curve really does work and is a good thing to do. It can hurt the economy, of course, but maybe the short-term harms to the economy are mitigated by the saving of lives that would happen. A couple other things. So Congress just passed this last week. They passed paid sick leave. This is a really big deal because the U.S. kind of stands alone in that we don't have paid leave policies. But they passed a paid sick leave for full-time employees. Well, you can read what's on there. And they also made changes to the Family and Medical Leave Act. Both of these are temporary, that only will last for a little bit, but they're both really important policies to have been passed. So the paid sick leave policy is particularly important because lower income people are often the people who have those jobs where they come into contact with a lot of people. So these are people like at restaurants or grocery stores, et cetera, and they usually don't have any sick leave or anything like that. And then since all the schools are out, a lot of parents have to stay home and deal with that. And so that's been really hard on a lot of families. And so this is a good policy change as well. There's an economic stimulus plan that people are talking about. It would be a really huge bill, almost $2 trillion. And the Senate Republicans and the House Democrats really disagree about what it should entail. So here's just a few of the facts about it. It actually provides more bailouts for corporations and not as many protections for workers. It would give about $1,200 to many families. It would kind of peter out if you make $75,000 or more. And one thing that I point out is that it would actually not give any money to the most poor people in the country. If you have a zero tax liability, you'd actually get nothing, which is another reason why the Democrats are opposed to it. So the Democrats in the House are probably going to try to craft their own bill, and we'll see what happens after that. This is the thing I'm probably the most frustrated with the president about. The Defense Production Act was passed by Congress during the Korean War, and what it says is that the president has power to force industries to manufacture critical equipment. And it can be used right now. All the president would have to do is really put it in place. We are facing a very critical shortage of ventilators, personal protective equipment like surgical masks, the gowns and stuff like that. And President Trump keeps on saying he's invoking it, but he actually hasn't ordered any supplies yet. Even though he keeps on saying that he hasn't enacted it, he really hasn't. So I think there's good reason to be frustrated there. Okay, so the next, I know that was really fast. I'm happy to provide any more information about any of those things if people have more questions. Here's a couple of the other questions that I got ahead of time. And then, so here's one. Will we be back to school next year? If we can't, will things stay the way they are? Honestly, I don't know. I told my sister today, who's a 5th grade teacher, that I think there's a chance we'll be online in the fall, which is really not ideal for a lot of people, but I am worried that it's a possibility. And the other thing is that, are there alternatives to make online classes better? Yes. We are doing this in the worst possible way, which is to say that we're doing it basically overnight with no planning and no resources towards it. But there is good research actually that online education can be very effective. It can be as effective as in-person education if it's designed correctly. And so I'll talk a little bit about what some of those things are later. But you should know that if we think that this is going to be happening in the fall, there are things that we can do to make the fall semester run more smoothly than this very chaotic transition mid-semester. So this is showing how much about school is more than just the curriculum. So how can we replicate the school setting while we're in quarantine? The first thing to know is we really can't. And so we have to adjust our expectations and adjust the expectations of parents and kids and students. We will just never have the same dynamic online as we do in person. And so we have to just think about the different pros and cons and try to emulate effective learning in different ways. One thing that I think is really important to talk about right now is if people want to do synchronous or asynchronous teaching. So synchronous teaching is like when you are live streaming like this, where everybody is logging in and able to watch at the same time. And asynchronous is when you record short videos and you post them online somewhere and people can watch them later. This is important to talk about because a lot of people would prefer synchronous teaching because it feels a little bit more natural. It feels like how we've been teaching in the past. But a lot of people don't have internet or have very slow internet. And so streaming online is a difficulty that they maybe can't overcome. It also ignores the very real caretaking that a lot of people are doing right now. So if you have older students, it's a good chance that they're also doing a little homeschooling of their younger siblings and babysitting. And it's possible that they might not be able to log into class at a certain time. So people who are kind of ignoring the synchronous asynchronous dynamic are ignoring the challenges that a lot of people are facing right now. In an ideal world, the people who sign up for online class know what they're getting into, but that's not the case here. People did not sign up for online classes, and so we shouldn't expect that they have all the resources to easily transition online, because the reality is they don't. Anyway, really briefly, there's a lot of things like flipped classrooms that can make online teaching really effective, which is where you give a little bit of a lecture in short video clips, and then you do more applications in person. I don't want to get too far into what makes for successful and effective online teaching, in part because I know a lot about how to do that in college, maybe high school, but I don't really know what that is in elementary school. I only know what I hear from my sister. What does that say?
BRB.
Oh, BRB. Oh, okay. I was like, do I need to read that? Okay, never mind. BRB, cool. Come back when you're ready. Okay, online school is good in theory, but disproportionately hurts low-income families. That's absolutely true. That is the case. So what can we do to support these people? There are some schools and other people that are trying to distribute food through school systems where people are local. I would encourage you to touch base with people that you know. So if you are a college student and you have friends that are struggling, I would ask what would be most useful for them. In general, it's better to donate to existing nonprofits rather than ones that are just popping up because they have the infrastructure to help right away. I would also look to provide resources to those people about where to find food banks, internet hotspots, and other things like that. Here in the state of North Carolina, the governor has put forth a lot of information online about where to find those things. And a lot of people don't know that you can just search for information on state governments. The other thing is that people often benefit more from like a cash donation than just dropping off food somewhere. So I think there's not a single good answer for what to do, but I think being empathetic and kind of listening to what the concerns that people have is really important. There's going to be a lot of people who are facing food and housing insecurity in the next few months and really in the next year. And so just knowing that those things are going on goes a long way. Okay, and the final question that was asked ahead of time has to do with student loans. And of course, I have a vested interest in this as well. So there is a short-term policy in place. So all borrowers with federally held student loans will automatically have their interest rate set to 0 for at least 60 days and maybe longer depending on what happens with this crisis. Borrowers have the option to suspend payments if they need to right now. And if you want to go into forbearance, you can. If you are a public school teacher and you are part of the PSLF program, which is where when you work for 10 years making payments, then you get your debt forgiven, I would maybe consider continuing to pay if you can afford it, and you can change your payment plan. But there's that source link right there, and I sent my slides along. It just brings you to the Department of Education's website. Okay, so they challenged me to do that in 20 minutes. I have to say I did it in less than 20 minutes. No, I did it in 23 minutes, which is pretty close. And I'm gonna end my screen share now, and I'm open to any kinds of questions that people have.
I'll try to help moderate from the chat. I'm gonna go back because we had some coming in. I know Louise asked about, I think there's been a lot of misinformation about the payments going out to folks. Have you seen things, or do you have any information about like the proposed plans in the state of where those are? Obviously, we don't have.
So that's the plan that currently is kind of stymied. So actually, just 2 hours ago, the Senate Majority Leader Mitch McConnell declined to actually have a vote on it in the Senate because it was pretty clear that it wasn't going to go anywhere. So right now what they're saying is $1,200, and it would be scaffolded based off of how much income you made, I believe in 2018. So not this most recent tax year, because they've extended the tax filing deadline until June. So they extended that. And it would be scaffolded based off how much income you make. And then if you have zero tax liability, then you would get $0. And so it would be about $1,200 per adult, and then I think $500 per child. And then there's some limits on it as well. But that hasn't passed yet, so we don't know. I think the Democrats are hoping for a larger check and for more than just one check, to have it be a monthly thing instead of just a one-time thing. But we don't know, because they didn't even vote on it in the Senate where that plan originated.
And Mohan asked, no COLA adjustments for payments, correct?
Nope, not as far as I've seen. COLA being the cost of living adjustment, so that it would be more in some parts of the country.
Sweet. I saw something up here about we had some conversation going on about a relative and hospital workers working without masks, which you touched on is a big issue. Someone asked about pause. If you want to elaborate in the chat, maybe we can get a New York program, I assume.
What program?
It's called Pause.
I don't think it is.
Okay. I have a question and something I saw in one of our things. Do you have any updates, or do you know about the census and how this is being impacted? Because I know that is something that impacts a lot of our work around education and funding for schools and so many things.
There's really two big questions right now. One is the census and the other is the election. So I'll talk about the census and then I'll mention the election thing too. So, okay, so from the census has already started. We should continue to tell people to do the census. What we know of the virus is that it can stay on physical surfaces for as long as like 3 days. So if you're really concerned, you can tell people just not open their mail for 3 days. But you can do the census online. I think there's absolutely a concern that places will be undercounted. And I think there is, so usually the way the census works is that they send out like through postal mail a way to complete the census to everybody, and not just citizens, but everybody in the US is supposed to do it. And then if you don't do it, they actually send workers around to go door to door and get people to complete the census. And that's actually very important, especially in lower income places, high minority populations, and areas like in Hispanic communities where people are a little bit more suspicious and have questions before they fill it out about where their information is stored and things like that. And I haven't heard any official updates on what's going to happen with the door-to-door canvassing to get the census done, but I would think that that is going to be hindered by this, because if people are told not to interact with people, there will be suspicion about opening doors, and I think some people will be wary. The census workers are temporary workers that are hired, and they might not feel comfortable doing that. But it is very critical. It definitely shapes education funding as well as other public service funding. So I don't have a solution to it other than to say I'm concerned about it. The other thing that people are really concerned about is the election. So I'll just briefly say something about that. A couple of states have suspended their primaries or delayed their primaries because of concerns that people would go to vote, stand in line for a long time, and then touch a bunch of buttons that everybody else has touched. And so a number of states have suspended their primaries or delayed them. And I think that I understand why that happened for a public health reason, but I think it's also maybe a concerning precedent too. Technically, the president cannot suspend the November election without the approval of Congress. I've heard a lot of people who are saying, this is bad precedent in the states. Is there a chance that we're not going to have the election in November? I think that's not really likely unless something really dramatically changes, because Congress would have to change it. And the other thing is that in law, the president is like no longer president on January 20th. And so if we don't hold an election, then there would be massive chaos because he, by statute, would no longer be president.
Super helpful, thank you. We got a really great question you're apt to answer. Rachel from Kentucky asks, or says, thanks for the helpful talk. And asks, some universities are moving toward a pass-fail grading system during the spring semester to accommodate school closures. Do you have any thoughts about this practice as it relates to equity? And then she says, our high school students are now debating whether to push for this idea too.
It's a really good question. And to be honest, I'm a little conflicted about it. So on the one hand, the kind of pros of doing that, going pass-fail, is that it relieves some of the anxiety of students who are facing a lot of trauma and turmoil right now and chaos in their lives. And so having pass-fail would kind of simplify their lives. And it would also simplify the lives of teachers too, who no longer have to grade in such minutia of detail. There's actually a website that lists all of the schools that have switched to pass-fail online. I can send that if you remind me at the end of this talk, if that would be useful for people. So the downside is that some students have been working their butts off to raise their GPA this semester to help them get into grad school or whatever, try to recover from a bad semester. And if you do pass-fail, you no longer get the credit of working your tail off to get a high grade right now. And so it could hurt, potentially it could hurt people's ability to raise their GPAs. And the other thing is that, and this is just speculating because we don't have any evidence right now, but we don't know what impact it could have for people who are like trying to apply to med school, for example, and need to show mastery of certain science topics, for example. If you just have pass-fail, that could mean that you got a C in OChem, whereas med schools would probably prefer to know if you got a C or an A in OChem. So those are kind of the pros and cons of it. What UNC and many other schools are doing is allowing students to make the choice for themselves, which I think is probably a better path forward than just blanket moving to pass-fail, which a lot of universities and colleges have done. So the let students decide approach would let students decide until towards the end of the semester, and sometimes even after final grades are posted, to choose if they want to switch. I think that's probably the best path because it allows those students who have a lot of anxiety about their grades, maybe for very good reason, to do pass-fail, but it also allows those students who are trying to raise their GPA to get credit for the hard work that they're putting in.
Thank you. We have another one, pivoting back to state governments. I think you made an interesting point about states not being able to go over their deficit. And so we had somebody ask about how we can convince our state governments to get more testing and to stop tourism. And this comes from somebody in Hawaii, which I imagine is a big issue.
Yeah, Hawaii, Las Vegas, I don't know what percent of the money for Nevada comes from Las Vegas, but a huge percentage does. So it's a big concern. I think governors just are having to face what they're valuing more, the short and long-term economic health of the state versus more people dying. And the evidence really is that this would be more people dying. And I think that governors are sympathetic to the more people dying argument when it becomes closer and feels more real to them. So I think when it's kind of an abstract thing, they think, oh, maybe we can mitigate it and avoid it. But once it's getting closer, so again, not to be too grim, but in Italy, they now are no longer treating people over the age of 60. My parents are 70. And so the reality is that the US is going in that direction. And so I think once we start getting closer and closer, which might be just a week from now, which is mind-blowing, I think more governors will jump on board with really shutting things down. So that is completely within the power of governors. And I do think that they listen to their constituents. So if you are in a state that has not started to shut things down, you should lobby them, reach out to them, be vocal on Twitter and wherever you can. And first shut down the bars and restaurants and the big shows and gatherings. And it's devastating. It's really devastating for both the restaurant industry and the tourism industries. But that's the best evidence that we have to be able to prevent people dying.
And the next question from Louise, I think kind of tail ends this piece about, I have a question about what are some of the ways students can spread awareness about the systematic and national inequity being shown by the virus, as well as accessibility. And I'll say quickly that, would love to have folks on this call who are interested. We've seen definitely media narratives painting the younger generation as not listening from physical distancing. And I think there's an important moment, but would love your thoughts on how we can be thoughtful about especially the equity pieces of this. How this is disproportionately affecting certain people.
Yeah, so there's a couple things to be said there. The first is the evidence suggests that Gen Zers are like polarized, like some people are taking it really seriously and then other people are really flouting it. So we saw in Florida last week, huge numbers of people going to spring break on the beaches of Florida. Florida is one of the states that actually already has a lot of cases. But a lot of other young people are really educated and aware of it. And the problem is that younger people I'm a millennial, but millennials, Gen Z, younger people, we are super carriers because we're less likely to show symptoms, and then we feel kind of an invincibility of youth, and so we interact with a lot of people and can spread it really quickly. So we have a particular responsibility to, I think, check our friends, hold our friends in line and educate them. I'll say personally that the other thing that I have noticed is that a lot of my millennial friends, we have parents that are now in these high risk categories. And actually the challenge hasn't been to convince my fellow millennials to stay home. It's been to convince my parents to stay home. So my mom is very much staying home, but my dad is not taking it so seriously. And that sentiment has really been echoed by both people that I know personally and in the media. So we have an education role to play, and we should publicly shame our friends that are flouting it, and we should call them out on it. But then we also need to try to figure out a way to keep our parents from going out at night, which is a weird role reversal from where we've been in the past. The other thing that I think is particularly important to add, and I can in part because I see a comment about it, but there has been an increase in violence and racism towards Asian people. We also need to really call out the racism of calling this things like the Chinese virus. We need to really educate people that that phrase doesn't make sense, that this is a virus that you can get in New York or Florida or North Carolina, and call people out who are saying some racist stuff, because both general racism and violence has increased, and this is not a time for that.
Thank you. And then that one sandwich in between there is from Gabriella, who asks about supporting students in unstable home environments and for whom school is a safe space.
Yeah, I saw an interview of a police officer who was asked what the biggest change that he had noticed since the coronavirus, and his answer was an increase in domestic violence, which I think we're going to see an increase in domestic violence. That's not just like partner-based violence, but also against kids. So if there are kids that you know that are in precarious home environments, you should be, do as much advocacy as you can. If you think that you should be reporting them to social workers, you should report them to social workers. I mean, that system is really underfunded and facing a lot of challenges right now. But the reality is that if they're in a precarious home environment and the parents become underemployed, it's a bad situation. The other thing is that we can provide resources. So if you're at a school that is able to, pass out grocery bags of food, I know some schools and school districts are doing that, and then just providing resources. But this is a really hard one because we can't see what's going on inside houses, but it's going to be, I feel like this is just like a really dire, I'm such a Debbie Downer right here, but it's going to be dire for a lot of people. And so we should do whatever we can. We should be aggressive about helping students that we're worried about.
And one other vulnerable population, somebody texted me that I missed, was Louise asked about immigrant populations and undocumented and folks who I think also related, of course, to any funding that goes out. How maybe to comment on those populations.
So a few things to say, actually. So yeah, immigrant populations, I'm super, super worried about people who are in ICE detention right now because they're already in pretty inhumane conditions that are really ripe for viruses spreading. And I think people will use us as an excuse to halt all immigration and halt refugees and asylum seekers. And on the one hand, it is true that we should try to contain as much as we can, and that there may be some argument to closing borders, and it's true that most of Europe has done that as well. But I think we should, hold policymakers in check if they're using this as a blanket way of kind of stopping people from being able to immigrate, long term, especially after this short-term crisis happens. The other population that I think we should be talking more about are people who are incarcerated. So actually, people who are incarcerated often don't have access to soap and water, or they have access to water, they don't have access to soap. Like, seriously, that's a thing. And they can't have alcohol-based sanitizer because it's alcohol. And yet these people are being used in New York, North Carolina, many other states as prison labor modern day slavery, in my opinion, to make soap and hand sanitizer for other people, but they can't use it themselves. So New York, I mentioned, is a hotspot recently of this epidemic, and indeed on Rikers Island, just in the last few days, we've seen this huge increase both among the people who work there as well as people who are incarcerated. These people also tend to already be in poor health, as are immigrants, especially from disadvantaged countries. And so the combination of already being in poor health plus being in poor conditions, not having access to soap is disastrous. So the other thing that that I want to add is that there's kind of a short-term consideration and then a longer-term consideration for this virus. And so these next probably 6 weeks are the most critical for physical distancing and slowing the spread. And that after that, we can start relaxing something. So it might make sense to kind of halt immigration or halt certain programs for the next few weeks, but it doesn't necessarily make sense that those things should be halted like indefinitely or permanently.
Sweet. Thank you so much. And I want to, of course, be respectful of your time, because I told her 30 minutes and here we are 45 minutes later. But I, of course, want to do a few quick housekeeping things. First, you should follow Professor Kreitzer on Twitter. Will you drop your handle in the chat?
Oh, sure.
Because she provides just like great Twitter commentary and really great relevant information you can keep up with. And then for other folks, adult allies and students, we're partnering with the Future Coalition to host daily gatherings, and where we're going to take time to dive in a lot deeper on some of these topics, starting with the census. So we're Student Voices responsible for hosting a conversation on the census on Wednesday, which is the 25th. So we will be diving deep and pushing that out on our social media channels. But in just a second, we're going to stay here so that we can open up for you all to talk. But just want to thank you, Professor Kreitzer, for this excellent presentation. It's been recorded, so we'll have that to share out with folks. Super useful information, and we'll also share out the slides with all of you. You have all your emails for registering. So thank you so much. Follow Professor Kreitzer, and yeah, this is definitely something we're all in together. Any final closing thoughts?
No, I don't have anything more to say. Well, I mean, I always have more things to say, but feel free to reach out if anybody has questions. I provide a lot of resources, especially on Twitter, for other educators switching to go online. And I'm happy to share those with people if they're, actually I can email them to you if that would be useful. I know that some of my friends and family that work in elementary schools have adapted some of the things that I've written about that. So I'll share that, I'll send those in an email, but feel free to reach out. And I guess I do have one more thing to say. At the beginning, a lot of people said that they were anxious and that this time feels like very surreal and crazy. And it does. It feels like, for me, it's very disorienting because there's really not a moment in time that we can compare this to. And I think I've talked with a lot of educators who are just like extremely freaked out about what's happening and how can we possibly teach online. And what I'll say to that is we are a community and we can help each other out. And this is like a really scary and difficult time that we're being tasked with something pretty impossible. But I have seen, I've seen good things happen too. Like this has really brought out the support in communities. And there was even a podcast this morning. What was it? Was it This American Life? Some NPR one that was in particular talking about how communities have really risen to the challenge online and on Twitter, and I'll send that too. It was uplifting. So I think we should acknowledge our anxiety and our fear and then just try to intentionally set it aside and be like, we're going to make the best of it. And I have a lot of faith that people can get this together and do it. And you don't have to be a perfect teacher this year. You're triaging. You just have to be there to support your students and do as good a job as you can. So try not to be too freaked out. Don't be paralyzed by it. And ask for help for your friends, and then check in with your friends because they might be freaking out too. So those are my final words. So thank you again for inviting me. And I'll see you all. If you ever have questions, feel free to reach out.
Thank you so much. All right. Thank you all for joining. For folks who are still here, we're just going to, I'll just take the next 10 minutes to just like debrief, hear a little bit about what you all are up to, and just like give you all the space to kind of share. I'll try to help facilitate so that we can, since there's still lots of folks on here. But if you want to like raise your hand, maybe you can use the raise hand function. You'll see it's above, you can see under the participant list, there is a raise hand function above the chat. You can see mute me or raise hand. And so if anyone wants to just kind of share either a reflection or something, you know, they would love to like use this group space as a way to source that, that would be awesome. Let's see, I'm gonna volunteer someone from the Kentucky team to kind of maybe give some of their thoughts or share out, because I know they've been doing lots of organizing on their side, because we also want to use this space for the youth-led orgs represented here. Let's see, I'm gonna volunteer.
Yeah, Gabriella, Rachel, do you want to speak to the Zoom chat that we had with a member of the state school board last week?
I don't recall if I was on that call, but I can talk about Kentucky in general and the experience there. I think it's been in general super reassuring to see how our governor has been addressing it. He's gotten a lot of praise on both sides of the aisle for a lot of his organizing work, and he's been really good about, you know, keeping people informed and taking really proactive steps towards organizing everything. Our schools have also, by and large, been very transparent about the way that they're going to approach this and have taken equity into account as much as is possible given the short turnaround with a lot of the food delivery programs that a lot of schools are implementing, in particular where school buses will drive around and drop food off at bus stops instead of making kids go to a school and pick it up there. So I think it's been good to see how equity focused the approach has been in our state, but also knowing that, you know, there's still a long way to go can be a little concerning.
Sweet. Yeah, and as you saw, it's I thought it was an interesting mention of Kentucky as a state who has like done really or been really aggressive from the beginning, and interested to see how that continues to play out, and all of your advocacy work. And I thought, Rachel, your question about asking about, you know, should Passfail be a system we're advocating for in high schools, is definitely an interesting one, and one we also at Student Voice are hoping to provide space for in the coming weeks. And we'll send a big recap email with all of our programming that we're launching. But we want to hold space for those conversations, because I imagine you're not the only one thinking about it. Let's see who else we have here. Louise, thanks for being so active. Do you have anything you'd like to add in reflection?
Not especially, I mean, maybe a bit. First of all, the call was really informative, and I'm really thankful that I got the chance to come in here and hear it. And I think some of the most important things we can do as students and also as younger people is to, first of all, stay away from other people, practice social distancing, but also to spread awareness through technology we have, like Instagram stories or Facebook, about inequities that are being revealed more and more due to COVID-19, especially equity based on accessibility or jobs or immigration, and also the racist behavior being shown just in general, but specifically perpetrated by Western media through this whole thing. And some of the videos I've seen of attacks on Asian people are very just like heartbreaking, because I mean, someone said this, I don't exactly know who, but viruses don't have races or borders. They're international, and so there's no reason to point fingers when the best thing we can be doing is to just make sure this thing ends as early as possible and we prevent it from spreading further. So that's my whole thing.
Thank you. And we'll be looking forward to see what we all can collaborate on together. I see, Hannah, are you still here from Iowa? Do you have any updates about work that's happening in your state or the work that the Iowa Student Learning Institute is thinking about?
Yeah, so our government has been pretty all of the shutdowns have been pretty recent. So a lot of the students in the state of Iowa are still trying to understand what COVID-19 is and how we're responding to it is still playing out right now. And so we were going to host an event called The Rally in the spring, and that was supposed to be April 7th, and where students learn how to talk to their legislators. And then we actually take them up to the Capitol and they do just that. And so we did unfortunately have to cancel that this year. And so I will be having a conversation with the executive director, because I'm the event manager, in a little bit to talk more over that situation and how we can maybe provide an alternative to that, and keep conversations about this going in our state. So we aren't currently doing anything yet, but the reason that I was on this call tonight was to see all the work that other states have been doing and how we could implement that in Iowa.
That's exciting to hear. And I know that there's probably lots of us who have had events canceled or programming we've been working on canceled. And so we definitely want to make these coming calls a space to work through some of that. And if that maybe needs to be a separate topic as a part of our daily social series, we can work on sourcing ideas for virtual gatherings, if that would be helpful to folks.
That would be awesome. I'd love to participate in that.
Let's see. Don't want to put you on the spot, but we have some great adult, Brennan, you're not an adult ally, I suppose, quite yet. Other youth allies. Brennan, do you want to share anything about your work with Peace First and how that might be helpful to folks here?
Yeah, sure thing. Hi, y'all. I'm an adult. I'm 23, so only sometimes. But I work for an organization called Peace First, and we do global youth leadership development. So we support, coach, and fund young people between the ages of 13 and 25 to start projects in their communities that focus on injustice. So obviously, a lot of the work that we do right now is really shifting because a lot of times we work with schools, we work with students that want to lead in-person events in their communities, and we're trying to figure out how to respond really rapidly to what's happening right now. And we are kicking off a series of rapid response grants to young people all over the world that are up to $250, and they help young people who want to lead a project that addresses the second order effects of COVID-19. So thinking about food insecurity, economic insecurity, mental health, ways that young people are connecting online. And we're really trying to fund as many young people as we can, and also start thinking about ways that we can bring young people together around the world to brainstorm best practices and feel connected in a time that feels really unstable and scary, and also is affecting different places really differently. So yeah, we've obviously, a lot has changed in the past week. We're still figuring out how to do a lot of this work. We'll stay pretty closely in touch with Merit, but if any of you all have ideas or want to contribute in some way, I'd really love to hear from you all. And I can also send out the link to the rapid response grants if any of you want to start a project in your communities. Yeah, so super happy to be here, and really excited to hear more about what other folks are thinking and creating.
Thank you so much, Brennan. If you'll send that link, and I'll make sure that link gets added in our follow-up email to folks as well. I see, I don't know if that's a good bye wave or a hand wave in the chat, but Jaren, if I'm butchering your name, please correct me. But would love to hear your reflection as our kind of closing reflection.
Hi, it's Jaren, yeah.
Jaren, sweet, cool, thank you.
So this made me retain a bit more information and how my state, Hawaii, can improve through like in governmental issues. Because as I said, we have a problem where islands is pretty much isolated, and it's easy to spread diseases and viruses if it comes to spreading and coming in contact with everyone. And we really need to improve a bit more. We did take few steps like extend school break, and we also, I don't know if this is a positive, lay off jobs, but I really see how other states are doing, and we really need to push. We really need to strive at that point. Thank you. That's it. Nothing else.
Thanks for sharing, and we hope you'll get plugged in to work, because we also have some other folks in our network in Hawaii who we can connect you with. But with that, I will wrap us up so we can stay in our hour time frame. Or I'm a minute over here, but thank you all so much for joining us. And again, this is part of a daily digital series. We'll have that lineup for our first full week of programming. So all of these conversations in our partnership with the Future Coalition happen at 5:30 Eastern and 2:30 Pacific. And those are going to be a wide range of topics around social justice issues and some fun things for you all to connect with too. So participate in whichever ones apply to your work or things you might be interested in getting involved in. But you can expect that every Sunday we will be the host of the conversations, and one weekday. And so we look forward to just continuing to stay in touch with all of you during this time. And we have lots more programming coming. And I want to thank you for your engagement and thoughtfulness in this chat and your overwhelming participation. You all rock. And I hope you have a happy Sunday and good luck in our second kind of hectic week in this brave new world we're all in. Thank you all.
So much. Thank you.
Okay.